Ali. Hi, and thank you so much for joining me here on Faces of Digital Health to discuss a little bit more what you're doing with Quadrivia. You've been in healthcare for over 20 years. You built Circle, a chain of private healthcare providers in the UK, then in 2013 Babylon, a digital-first value-based care company with the mission to make high-quality healthcare accessible and affordable to everyone on Earth. Babylon disrupted the NHS and scaled to the US market, but given various circumstances, had to file for bankruptcy in 2023. Now you're building Quadrivia, which some refer to as Babylon 2.0. Quadrivia has a similar mission than Babylon to reshape healthcare delivery through advances in AI technologies. So what is Quadrivia? How does it differentiate on the very vibrant market for healthcare AI in 2025?
It's a really good question, and it goes to the core of our desire as human beings to matter and to be different. But actually, I'm not sure for a consumer or for humanity, it really matters that what is our differentiation or what makes us better, as long as we do the job. And I think the job, which is not done, and the promise of it is huge right now. If you think about what we just talked about, or you just very kindly outlined, our mission has been to make healthcare accessible and affordable to everyone on Earth. And if we really kind of analyze what's the root cause of this inaccessibility and unaffordability, it really comes down to economics 101, which is an imbalance, and a structural imbalance in healthcare between elastic demand. My kid gets sick, I do anything, spend any money that I can to help him or her, and a very constrained supply. And anytime you have an imbalance between supply and demand, you will have inaccessibility and unaffordability. With AI, for the first time, we now have the promise of creating elastic supply of clinical skills. And that's what Quadrivia is focused on. It's incredibly hard, because I don't think everything a doctor does, a nurse does, a clinician does can be done with AI today. AI is just not good enough yet. But there is about 20 to 30% of what they do. There is very routine, repetitive clinical tasks. And we focus on those clinical tasks to get them done in real time. Not administrative tasks, not the kind of tasks that you co-pilot, but the kind of tasks that are real time and can be done autonomously by AI. And we can talk about that, but that's an incredibly hard thing that no one has achieved yet. Let me just talk about that for a second, if you don't mind. I don't want to go on a monologue, but this one is important. Like, we have all the people call AI, they say, oh, look, there is AI everywhere. It's just like saying, but the next decade, I think, is primarily about transition of labor, some labor from humans to machines. And if you think about humans, we do all sorts of labor. You're podcasting, I run a company. In healthcare, somebody's a receptionist, somebody's a typist, somebody's a nurse, somebody's a doctor. And the AI does these different jobs, so it doesn't make it the same AI in the same way they're not the same human. So there is a lot of administrative AI right there. They take notes, they help with some administration, payment, claims, this, that, the other. Often they're co-pilots, which means they do a job, they get it 70, 80% of the way there, 90% of the way there. Then a human comes in, corrects it, and sends it out. These co-pilots are very useful, but what we are trying to do is build an autonomous, real-time clinical AI that can talk to a human being on a phone or through text in real time, autonomously, about clinical issues. Incredibly hard thing to do. And we can talk about why it's so exciting the boundaries of the technology that we are exploring.
Absolutely. We'll definitely talk about that more in details. But just maybe for the listeners that aren't as familiar with AI agents. So Quadrivia is building a Q, which is an AI agent. You actually have three categories of agents, one for clinical workflows, one for health problems, and one for health Q&A. Can you, in a very simplified way, explain what AI agents are? How do they differ from just generative AI or chatbots that people use?
So an agent in today's parlor is an AI that does something. So you give it a task and it delivers that task. So for instance, I'm a doctor, I call Q, I say, hey, call all the people I do surgery on and make sure their wound is recovering. So the agent then goes into my clinical records with my permission, takes the record of the patient out, they know who they are, then understands it, digests it, then it understands the task, call the person and see how they're doing. So it needs to generate the questions it'll ask. How are you? How is the wound recovering? Do you have any temperature? Does it feel warm? This, that, the other, right? And checks it with the doctor. The doctor says, yes, that's absolutely right. Then almost picks up the phone, dials the patient. If it's unsuccessful, waits an hour, dial again until it reaches the patient, have that conversation, figures it out, brings it back, summarizes the conversation, put it back in the clinical note, create a table, gives it to the doctor that 20 patients I called, here is the results on what all these 17 are okay, these 2 you need to keep an eye on, this one you need to call. So it's a task that it's performing, and that task can be anything from checking on medication to giving the results of a lab test to following up on a surgery or preparing a patient for colonoscopy.
Okay. So basically the AI agent needs to follow a set of rules, and it also does follow up. It doesn't just do one task, right?
Yes, it does.
So,
This is a very comprehensive agent we're building that understands medicine almost end to end because it sits on generalist AI platforms like Gemini. Secondly, it's highly customizable because each doctor, each nurse, each institution want to do something their own way. So you can talk to it and say, don't ask that question, ask this one, check this thing, and then it's highly controllable. In Europe, you're not allowed to do that. In the United States, absolutely go for it. So it is very important that these agents are just like, think about it as if you were hiring a junior nurse, a junior doctor, and you were giving them the repetitive task that you do that you don't want to do or you don't get time to do, but asking it to do it at massive scale. It can make phone calls in hundreds of thousands.
When it comes to AI, the source of knowledge is incredibly important, and I'm glad you mentioned the clinical data sources. Can you talk a little bit more about that, the knowledge base that you're using, and how are you basically updating that knowledge base given how fast, knowledge in medicine is increasing? How does a knowledge bit become a valuable and trusted part of your knowledge base, and how does that change over time, when the clinical practice changes?
You put your finger, because you know so much about healthcare, on the core issue of a knowledge base, which is it is changing all the time, it's very comprehensive, and it is different in each country. So and frankly, it's very different in each institution. So what we built is a hierarchical knowledge base and a rack system that, I apologize, a hierarchical knowledge base and a rack system that will enable our agent to basically, based on your preference, to say, look, you go first and start with my personal knowledge, the books I've written, the articles I've written. You then go on to my institution's knowledge. I work at such and such institutions, everything they published, our processes, our way of doing things. Then to the US medical records or the NHS knowledge. And then you go to the general LLM, right, knowledge. But because we go through this hierarchy, we also are eliminating or minimizing the chances of hallucination because we have sources of truth that we can rely to and we can quote. That where is this knowledge coming from? And experiments have shown now conclusively that when you give the LLM the opportunity to think and to choose from selected knowledge bases, you can minimize its and check itself against what it picks. It can minimize its hallucinations, which is what we have done.
I'm glad that you mentioned hallucinations because, they're definitely a huge concern, especially when regular people use unspecialized AI systems for medical advice. But what I'm very curious to hear about in your case is how do you prevent AI agents from improvising when running a clinical workflow? So it's not about, you mentioned, so Q uses structured workflows, and in multi-agent systems, we often see the workflow drift where the agent starts to hallucinate steps. So it's not about the knowledge, but about the steps that it needs to take. So suddenly you can end up in a very different place than you wanted to.
You gave me a really good idea. We should actually make a film of the generation of our workflows and share it with the public, because you're absolutely right. What we do is we talk or text with Q and say, hey, let's just use the example I used before. I want to do a follow-up on my patients that I need knee surgery on. Tell me what steps you would take. I don't even want to think about it, right? Q will go through all my processes in the past or to the knowledge it has from LLMs, right? And would say, okay, I will call and I will make the following 5 questions. I will ask the following 5 questions. I will come in and say, look, and you can actually see it on the screen. A whole chart flow gets created. Here is the flow of what I do. I can go in and say, don't ask this question. Instead, ask this one. Check their identity at the beginning. By the way, for this question, I want you to precisely ask the words I say. So you type the words in or you say the words. So what we have done is in a very indeterministic architecture of the generative AI, we have introduced deterministic elements. And then when I lock, the workflow is locked. Q does not deviate from it. That presents another problem, which is you and I are talking, you ask me a question, I am saying something, you may want to jump in and say, hey, by the way, tell me something else, or I may just say something. So Q now needs to remember that it cannot tell you, sorry, I'm not going to talk about this because that's rude and unempathetic, but it needs to talk to you about that, but go back to its solution. And all of those, remember what we talked about. I need to check, I need to, all of those need to happen within 13 to 1500 milliseconds. That's 1.5 seconds. 1.5 seconds. That was my post. 1.5 seconds. Anything longer than that, you think I'm crazy, right? So it's incredibly hard thing to do. Because imagine what happens in this 1.5 seconds. You tell me something, I'm Q. I now need to take your voice, translate it into text, look for any inaccuracy in that transcription, which exists. The best models are still about 6% inaccurate, right? Check maybe something with you. Then send it to our cortex, right, our brain. Our brain will check it for identifiable data that shouldn't kind of be sent around, then sends it over to the our LLM or our other servers. It gives the answer, comes back. We need to check the answer against our guardrails. We have about 50 guardrails that is checking for safety, for all sorts of issues, safeguarding. And then once it cleans it all up, puts the identifiable data back in and just communicate with you. All of that needs to happen. And so it's a really hard task. There is a reason why people are not doing it yet. But I think, but we are now starting real world experiences, and I think it's going to go really well.
Yeah, tell me a little bit more about that. Quadrivia is still very young. It's a year-old company. It was founded in 2024. I believe you have roughly between 20 to 30 employees, if the pitch book data is correct. And I heard that you are already planning on going to go live in Spain, in Singapore, in the UK. So how do those rollouts look like?
So, as you said in your very kind introduction, I'm old and we've been around for a long time, so we have relationships across the globe. And when people heard what we are doing, very kindly from all sorts of places reached out to us. Of course, our biggest market that you didn't mention is United States, and that's where we are super focused on. But, you know, nobody told OpenAI or Gemini or even DeepSeek, which was a tiny company, when they launched their AI, that why are you not only in one country? The whole point of AI is universal. It can translate into different languages. Problems are the same. As long as we have a hierarchy of knowledge bases so we can customize to each and for each country and control it for the regulations of those countries, there's no reason why we can't do it in different countries. So we on purpose decided to go live globally because we want to see, in a limited numbers, but we want to see what we are learning across the globe. Companies that succeed today are companies that are born global. Companies that want to limit to a single country will find it very difficult because they learn everything about that country, but then when they want to expand, they will not be able to, in my view. Now, some people disagree. Some people believe there is that you start in a very narrow way and go. But I just think that goes against the core of the capabilities of AI. And if you think about where did that come from, that came from the old workflow software, if that, then that kind of approach. If you had to write every iterations of a workflow, you were very limited to all your capabilities and what you could do. But if you're generating the workflows and you're generating your answers, then frankly, there is no limit to what you can do. So why put constraint on it artificially?
It's not, I don't think people, when they start companies in healthcare, I don't think they start locally just because they wouldn't have big ambitions. It's more because, you need to build trust in other countries that you go into. You either need local partners. It can very quickly backfire if you enter a market too confidently. We know that if you go from Europe to the US, you can't operate usually from Europe. You need to have an office, have employees on the ground, meet people, gain that trust. This is what basically makes scaling in healthcare so slow. It's that trust building part is so manual. So that's why I was kind of curious how you are going after, different markets. Also, from the perspective that clinicians are very risk averse. They're very specific based on the institution that they work in, country that they work in. You can have national guidelines, but then the hospital has local guidelines. So from that perspective, it's super interesting to know how you scale. I know that you mentioned that the workflows that you do can be configurable. That's in the white paper. So I don't know, maybe you can talk a little bit more about that. So how do you tackle the whole cultural aspect, trust aspect, my workflow or my clinical guidelines are the best guidelines out there type of a mindset for people to use your solution?
See, everything you said is true, and yet all of those truisms in a world of AI is melting into air and new realities are shaping, right? So let's just take the workflows. As we said, if you had to write your workflows manually, line by line, if that, then that, if that, then that, then think of all the variations and think of the sub-variations of all those variations. That was an elongated, long process that it took forever. Today, we can generate those workflows within seconds using generative AI. We can control them using deterministic, indeterministic architecture. We can have a cortex that can limit it and customize it. And we can do all of those within minutes for you. So any doctor, any nurse can come to our platform if they have access to it or when we release it, and they can play with it and change it. So in that respect, yes, what you said was true in the old age, not true any longer if you build the architecture of your cortex correctly. Mm-hmm. Secondly, you said that trust is very local, and that is absolutely true. So we employ people from across the globe. So you said UK, United States, Singapore, Spain. We have local employees who are trusted in those localities. Half of our employees, for instance, sit in America, a big chunk sit in the United Kingdom. And
how come you're in Spain? How come you're in Spain?
I am a huge believer that in today's global world, you can build a company from anywhere, right? And Spain is as good a place as anywhere. I just, when I wanted to build Quadrivia, I was lucky enough to be contacted by my friends in Norsken, who very graciously offered to help us when we had nothing but an idea and 2-3 people. And they have Norsken in Barcelona. And they asked me to work from there to help build the ecosystem or just be present in where they are. I'm not helping, they're doing all the work. I'm just lucky enough to be part of it or to benefit from it. So I moved to Barcelona to do that work from here. The reality is I'm not here. I mean, last month I must have slept in 15 different cities. So when you're building a company, you go where your clients are.
Yeah, absolutely. You explained a little bit about, how adaptable your product is to an individual user, which kind of enables it to work in different markets. And I'd really love to pick your brain on how do you see that AI companies can differentiate on the market. We've seen a global race, especially in the US, among the providers of AI scribes. But then in August this year, Epic unveiled an AI scribe solution called Art for Clinicians, Gen AI tool for revenue cycle called Penny, and then an AI solution for patients called Emmy. Epic is also working on more than 160 AI projects. So the general feeling in the industry was no matter what you do, at one point, like a giant can eradicate all your efforts. So, how do you see that companies can still make it? How do they stand out, especially given that you need to often integrate with Epic? This is also on your roadmap to integrate with Cerner, Epic, and other EHR providers.
Yes. So, look, it is a disease of our form of capitalism, especially the Anglo-Saxon form, that we fundamentally allow a very tiny number of companies dominate the entire market. So I want to fly to United States. I have three choices of airlines: United, American, Delta. I want to stay in a hotel, three brands. They may have different brands, but three companies dominate everything: Marriott, Hilton, Intercontinental, right? IHG Group. I want to buy my ticket. Again, I can only use Visa, MasterCard, or Amex, right? That is a disease that we have created that actually goes against the core of capitalism, which is to allow the new to flourish, to replace. And so much of our problem in our societies is because of these duopolies, oligopolies that we created in our model of capitalism. So don't get me started about the fact that Cerner and Epic kind of control this system. And the truth of the matter is that so much of what we suffer from is because of the fact that they are slow, they can't move fast enough, that they dominate so much, and then they collect rent from it. I am yet to see people who are super happy about these things. Having said that, I have a huge amount of time for Judith and what she's done with Epic over such a long period of time. And if I was going to, or if I'm sure a bridge was going to compete with Judith herself on scribing, for instance, or in our case in agents, we'll be really scared. But the truth of the matter is Judith, like any other company, needs to hire some manager who is not an entrepreneur, who doesn't live, drink, eat that thing day in, day out, who needs to go build that product, who probably works 9 to 5, 9 to 7, it doesn't matter, but they're not an entrepreneur, they're a manager. And they kind of go and build that product. Then they have the politics of the organization. Which one do I prioritize? Which one don't I prioritize? Which one I get funded for? Who do I get in my team? And bit by bit, and as a result of that, if you ask me, do I back the entrepreneurs behind these scribing systems, or do I back some big giant with their managers? I will back those entrepreneurs every day. And thank God for that. Otherwise, what did we exist? And if you come to our area, look, I work 14-hour days on one thing, building these agents. That's all I do. I don't have to worry about the politics of other things, my organizations, EMRs, this, that, the other. By definition, I may not have the money, not the resource, not the number of people, but I am smaller, humbler, faster. And that's the thing I have over everybody else. By the way, Epic said they will bring the simplest thing that existed 2 years ago, the scribing product, out in 2026. That whole announcement was designed to tell the laggers, you don't need to do anything. Wait, eventually at some stage I bring something up. Pioneers don't wait. They move on, they solve their problems now. And those who solve it for them get better and better at it. Eventually they do really well. That's my view of the world. It's an optimistic view that says that entrepreneurs can win by being faster, humbler, quicker, working harder. And it's paid off so much for me.
Absolutely. It's, for sure true. You can be much more agile because of the lack of structure and coordination that you need when there's less people involved in decision making. If we look back at your experiences with Babylon wasn't just active in the UK. You then went to the US. You also went to Rwanda, which was quite a big story, I guess. Is there anything still in Rwanda? So what's kind of the legacy of Babylon that has also followed Quadrivia? Do you have any employees that also work with you at Babylon that are also now with Quadrivia? What are you going to do differently now compared to with Babylon? And this is maybe just from the business perspective. So how are you thinking differently? I know that you like to say that, you shouldn't be stuck in the past, but you can definitely learn a lot from the past.
You're 100% learn. And you're very true that we made a lot of mistakes that I hope we never repeat again. But the only way not to make mistake is not to do anything.
Yeah.
So everything you and I do, I'm sure if we do this interview again, there are questions that you will ask differently. There are answers I would give differently. But look, you just got to do it, right? I
Yeah.
mean, just you got to do it. I am incredibly proud of what we and the team in Babylon did. In 2012, when we created Babylon 2013, the idea of being able to deliver most of the healthcare most people need on the mobile phone they already have was laughable. I remember being laughed out of a medical meeting by people saying, what are you talking about? Who would be seeing that? Like, this is now commonplace. The fact that we were delivering a quarter of primary care in a country like Rwanda was unimaginable. Today, the woman who set that up is the head of primary care for Gates Foundation and is rolling out that model across the developing world for many to do. In Rwanda, even though Babel, our company, doesn't exist, its legacy does, and other companies and other people are doing pretty much the same thing. But across the globe, people are doing it. So I'm super proud of what we
Yeah.
achieved. When we started saying that AI will take the burden of automation away from us, people were saying that AI, well, we were early, but look at today, AI today and what is happening. But we also learned quite a lot. We learned that if you want to go fast, you go alone. So you go with a smaller number of people. We wasted time and effort and energy by maybe raising a little bit too much, not having the discipline of how to invest it exactly. We lost control of our mission towards the end, or control of our company, which meant that those that we didn't control lost control of our mission in the last 6 months. There's so many things. At some stage, you and I should write a book about this. But the amount of lessons we learned are huge.
Yeah.
But that should not be the narrative about Babylon or about anything that everything at the end fails. There is no politician whose career doesn't end up in failure. There's no company that exists forever. There's no empire that exists or country that exists forever. Everything changes. And we should stop obsessing about focusing on what went wrong. And the psychology behind that is because those of us who haven't done it often want to satisfy ourselves that, look, you see, that's why I didn't do it. And we want to tell our children and stop our next generation from saying, you see, don't do that, because if you do it, it fails. Instead of saying, you see, they did that, they proved it could be done, and even though they couldn't carry the path, look at how many others have picked up the baton, and are now delivering the same thing. It really doesn't matter which individual, which person does something. What matters is it's done, and then humanity can benefit from it under whatever persona that carries it forward.
Yeah. I've been thinking about, failure and how we define failure a lot lately, because 2 weeks ago in Malta, I had a discussion with a UK founder who, after 17 years, sold his company for 1.5 billion euros to a Japanese company. But when you look at the journey to where they are at the moment, like, they almost disappeared from the market for, 7, 8 times. And, well, now they were sold, but does that make them successful, if you know what I mean? It's like the journey still continues. So it's really, I guess, stories can make success sound like a romantic comedy, but like there's always a lot of hardship with it. So, when I asked what are you going to do differently, what I kind of meant was more of the practical things that you just learn by being in the business for a long time. You've been in healthcare for over 20 years. I think in one of the interviews you said that one of the kind of things that you keep thinking now is that you should never take debt, because that was one of the challenges with Babylon in the end, that the debt collectors just stopped supporting you, and despite the fact that you could continue, you couldn't, in essence. So, just kind of practical things that you see, maybe even from Circle. You were the strong leader that made the company what it was. Many things went wrong after you left. So, reading on all the past, I kept wondering, do you think things would be different for Circle if you still stayed in Circle. What's your perspective? Also, maybe on luck in entrepreneurship, which is often neglected when we try to define success. But sometimes it's really about, were you in the right place at the right time to meet the right people that then supported you, etc., etc. So just, I don't know, any thoughts?
Those are a lot of questions.
I know. That's why I'm just like,
Maybe we
respond to
should take
whatever
them.
you want. Yeah.
Wonderful. Maybe I take them one at a time. But look, I learned a lot, a huge amount during the 20 years. And if I want to distill all my learnings into a single thing, it'll be for an entrepreneurial business, not of our time, of any time. And it goes back to the conversation we were having earlier. The only advantage we have as entrepreneurs is a speed, nothing else. We don't hire more clever people, we don't have more money, we don't work any harder. The only advantage we have is a speed. Therefore, everything we do in our companies should be designed around the speed. So start with people. People, product, processes. Let's just look at each of them. That's what creates a company. It's people, it's product, and it's process. On people, I hire for 4 things. I hire for competence and experience. Why? Because I want somebody who's done it before and therefore they're not learning on the job. Even what we are doing is brand new. At least I want them to have experience of knowing what they're doing, right? So we hire very small number of people, but we are relentless about if you make it to our team, you've kind of are top of what you're doing. Secondly, we hire for sheer intelligence. What we're doing is super hard, and we want very sharp brains who can understand the enormity of what we're doing. Smaller brains will reduce the job to the size of what they can understand. So we hire for super intelligence. Thirdly, we hire for missionaries, not mercenaries, again for speed, because everything will eventually at some stage go wrong before it comes right again. And when things go wrong, mercenaries leave you, and because they left you, they slow you down, or they create all sorts of issues, right? So you want missionaries who at the time you need the most to have the zeal to work hardest, because they don't care about the mercenary part of this. They just want the mission accomplished, right? And fourthly, we hire for kindness. We just genuinely want really nice people who don't play politics or kind to each other, because what slows an organization down, half of it is the politics, is the meanness, is you're thinking, what did she say, what did he say? So we create an organization that is made of these people. Secondly is the product. We are relentless, and we haven't launched our product properly yet, because I don't let a product that is not excellent to leave the thing. There's this whole thing that minimum viable product. What nonsense is that? Your customer should not be subjected to the minimum viable anything. They need to love your product when it comes out. So and it needs to be built right. Why? Because if the foundation of the product is right, then iteration on it is super fast, right? Otherwise, you don't have debt legacy, you don't have the technical debt that you need to deal with. Thirdly, processes, right? We are relentless on basically the same processes that actually Elon Musk had advocated and pioneered. So we question everything. We delete everything that is unnecessary. Just recently, we deleted 40% of our code base. Why? Because technology has moved on. We said, why do we carry this? Painful, right? We deleted it all, right? We then simplify to the degree that people are saying, this is just far too simple. Simplify, simplify, simplify. And then we basically try to speed up these processes, and then eventually, only then, automate when we have maximized the cycle speed. So to me, that's the biggest lesson I learned. Get your people, your product, and your processes optimized for speed, and because that's the only thing as a startup you have. So that's your question on what I learned. And by the way, the other thing I learned is never lose control. I lost Babylon within 6 months of losing control. And I lost it completely unnecessary, right? I mean, if you think of companies like Oscar, who at the time were also in the same trouble that we were, and they're now back at $5-6 billion company. if my shareholders or debt holders just gave us that 70, 80 million gap that existed at the end, we'll call it 100, but just to say we had also some cushion, today we would have been a multi-billion dollar company because all our AI, all our customer, all the wealth of knowledge we had would have now flourished. I mean, it's the most stupid disagreement between these people that I had ever seen that unnecessarily killed the company. But let's just, and by the way, they were not wrong. They were looking after their own pressures, right? It's not as if they did something that is immoral or wrong. They just were looking after their own interest at the time, or thought they were. In reality, the consequences actually didn't look after their interest either. So that's the other thing I learned. You ask a really good question, which I forget at the end, about something else, which wasn't about the lessons I learned, but about luck. So I remember that. Look, luck is everything. Anybody who tells you, oh, luck has nothing to do with it, I think the moment you're born, to your mom and dad, who they are, how much they value progress, what culture they have, which country they're in, what class they belong to, all of that already decides your genes and how they spend the first 6 months to 12 months of your life to shape the neurons in your brain. That determines 80% of your life, frankly, right? So all these people who come in and say, look at me, what I've done, I'm amazing. Like, guy, you were lucky to be born to those parents, to that country, in that situation, and everything that hit you. And I think with Babylon, we were super lucky to get to where we got to. We were super unlucky at the end not to. It could have gone either way. I'm a huge sport fan. I used to, when I was younger, do a lot of sports. I still do for what I can. But I tell you, if you play sports, you know it's a game of inches. You win or lose a game because the ball went 2 inches that way or 2 inches the other way a couple of times. That's it. That's football for you. As long as everybody's at the same standard, which today, for instance, in UK Premier League pretty much is the same. So you have to work incredibly hard to get to that level, but from there, all sorts of luck plays into it. Look,
I think it's interesting that you say that because there's I guess the U.S. mindset is that everything's possible. You can be whatever you want to be. Many would probably also deny that luck played a part in their journey because they work hard to get where they are, and for them, basically, you would probably be the embodiment or the proof of this narrative, given that your background, you were a refugee when you arrived into the UK, so you also had a lot of hardship to get to where you are. So it's a separate discussion, I guess, all along. I really like the quote that I saw on a wall somewhere when I was traveling, that serendipity is luck mixed with preparedness. So, as an entrepreneur, you just have to go to all these conferences or the event, meet people, and then somewhere you're going to meet the right one. But you wouldn't do that if you didn't work hard as well.
Do you remember when Usain Bolt dominated the 100-meter runs?
Mm-hmm.
You remember that period?
Yeah.
And of course you remember Usain Bolt. Who came second when he was running?
I have no clue.
He worked so hard to be prepared to be at those world championships, the Olympics, and yet he was so unlucky to be running against Usain Bolt. Exactly. Any other year, he would have won it, whoever he was, right? So you need to work incredibly hard to be prepared to be at the top, but you also need to be lucky that the circumstances work your way. And a phenomenon like Usain Bolt, which is the tallest guy who ran this, the most incredible athlete, is not there fighting against you, because physically, what can you do against somebody like him, right?
Yeah.
So both of those things are true, what you said. You need to work incredibly hard. There is no prizes for the lazy, but you also need to be super lucky. I always say, may I live a life unmarred by laziness, conformity, and cowardice.
It's inspiring and terrifying at the same time, because at the one hand, you know that you don't really have control and the future is unpredictable, while at the same time, I guess you can still hope that, things are possible.
But you do have control. Look, you are where you are. I am where I am. We all are. Because we had huge amount of luck and huge amount of unluckiness. And where we are is not the consequences of any one of those lucks or any ones of those unluckiness. It's the way we negotiated ourselves through those currents, right? And that part, that ability to negotiate, the decisions we make are with us. So that capability is there. I'm an open water swimmer. I swim everywhere. Because I know that as long as I'm cautious, I stick to the coastal things and don't go too far. As long I can swim through anything, right? Almost, give or take. Would I be as fast? Sometimes I'd be super slow. Sometimes I barely make it, but I can swim through it. Usually have, right? So that's life. You just have to be an open water swimmer. You don't know what you're gonna face. But you just have to have the skills and be prepared to go through it. And the mental strength, I mean, sometimes you're in open swimming, you have gone too far. Now you gotta go back. Your energy has all run out. There is nothing left in the tank. But you just have to keep going. There is no stopping there, right? And it's that mental focus on not letting bad thoughts through that gets you there. And that is with you. So you're right. It's petrifying because you don't know what's ahead of you. But it's incredibly empowering because you know what is inside you.
Well, you kind of, got me thinking about when you said that it's petrifying, and sometimes that can be very debilitating. Like you can just freeze by the fear of uncertainty. Like, how long did it take you after Babylon to start thinking about Quadrivia? Like, how did that idea come about? Immediately.
Yeah.
You were just like, move on, next.
Sadly, we put Babylon into administration, chapter 7. I think it was, or administration at the beginning of October, and we actually registered Quadrivia at the end of October, I think. And we were immediately on it. Now, I knew what I was going to do, but it took us a bit of time until the beginning of 24 to get the team together, then to formulate it. And what we wanted to do was unthinkable at the time, right? A real-time agent who can call you, talk like a proper human being, not for one singular task like some companies do it, but across anything you want to talk about in medicine, and be highly customizable, highly controllable, and sound like a human being with very little latency. I mean, at the time, that seemed like magic. Remember, nobody talked about agentic AI in January, February 24. And 2 years later, almost we are finishing 25. That seems like commonplace. And it's still nobody does it. I mean, when people see what we do, they find it magical. Because you just pick up your phone and ask the agent in your chat GPT to book your next travel. It cannot. It pretend it does, but it can't. Do it. In reality, it doesn't get done.
We are approaching the end of the discussion. So given that, Faces of Digital Health focuses on how different healthcare systems adopt technology, I do want to pick your brain a little bit on what you learned about the different markets that you've worked with so far. So the NHS, probably from top down. You went to the US, Rwanda, we mentioned Singapore and Spain. What would you say about these markets? What are kind of some of your observations? Anything that you find interesting? Just any insights that come up?
So my biggest insight is you find amazing people who want to do amazing pioneering things everywhere. They're not limited. They're no more in United States than they are in Rwanda or in Singapore or in UK. it is true that some countries have a more tendency to pontificate, to find ways of not doing things, or some organizations, some companies, and some are much more pioneering, go-getting faster. But at the end of the day, you will find that collection of 2% of pioneers everywhere. Our job as entrepreneurs is to identify those 2%. So I don't care if 98% of of a group of clinicians, for instance, you said earlier, like clinicians don't take much risk. Clinicians take risk like any other section of the population. 2% are massive pioneers, 15% are early adopters, there's another 35% early majority, so on and so forth, right? My focus is that 2% of very early pioneers, and those 2% exist in UK, they exist in America, they exist in Singapore, in Rwanda, anywhere you look, that 2% exists. My job is to hunt them, to find them, and their job is also to find me, because they also want to live through innovation. And then it's our collective job to bring the new, to show it off, to create references, so then the next 15% find the courage and the confidence and the trust to buy it. And that 15% creates the core that everybody else can rely on, can hear from, and then the thing takes off.
So, yeah, I guess that's the part of magic, again, to find those people in all those different markets and to find the chemistry between you and them, so you can build new magic together, I guess.
That's our job, right? That's what keeps our societies going. From personal relationships, you find each other, you have magic, the next generation comes to our companies, right? You find partners, you come together, and you create a new product, a new service. It's been an amazing opportunity and time to talk to you. Thank you so much for talking to me. But my final parting message to our entrepreneurs is what they've heard before. There has never been a better time. Everybody will tell you that you may fail, you may not, it may work, it may not. You will always work your way through it. But one thing you will not want to do is to be sitting on the other side of what is the biggest transition of economy that we've ever seen. This massive transition of labor from humans to machines, some labor from humans to machine. And you sit on the other side of it and say, I could have taken part, but I was too lazy, too doubtful, too hesitant to do that. Go all in, and you'll figure your way through it.